I'm Abe Lyle. I'm a pediatrician. I work for Maine Quality Accounts. We're putting together the Maine Child Health Improvement Partnership. We are actually funded through the CHIPRA grant, which is the Child Health Insurance Program Reauthorization Act. It's a 5-year grant from CMS to Maine Care, and Muskie is subcontracted to run the grant. We are subcontracted to do quality improvement work. Karen Chamberlain is here from the Muskie School. She actually runs the main part of the IHOC grant. What I wanted to talk about is a couple of years ago, with the patient-centered medical home movement, they came to a bunch of pediatricians and said, can you start to look at these metrics, not only for the patient-centered medical home, but to update for Pathways to Excellence, and for lots of different reasons, look at the quality measures in the state. So I just wanted to go through what we have done as part of this process in terms of updating the immunization rates, the quality improvement work, and also the work on the metrics, work around asthma, and then the work on the metrics, how we got there to these PTA metrics today, so people have the background story. Because I feel like when I'm talking on the phone with people, they don't understand all the work that's happened on the pediatric side and with the family medicine groups on these two issues, and why we're asking for the update, and why we're ready to vote today. Okay, here we go. So there's a lot of work happening in the state on immunizations, as you know. It's actually, immunizations is one of the greatest health achievements of our time, but we are experiencing some hesitancy from parents in terms of getting vaccinations, more refusals, more delays, and we're also seeing outbreaks of measles and pertussis. So there is a public health issue going on in the state. We really need to work on improving our immunization rates. Our immunization rates have stagnated from 62 to 74%, and our rank in the state, we used to be one of the top states in the country for immunizations, has really dropped over the last 5 years. So I really think it's important to highlight the immunization metrics. One of the things that we've been working on is called the First Steps program. It is the learning initiative that we've been doing with practices over the past 2 years. It's a 3-year project. It's strengthening together early preventive services. Our first focus is really on immunizations and trying to get all the groups in the state working on quality improvement around immunizations. Because we really need to have a coordinated effort on this. This is actually, First Steps is a 3-step project. We're currently working on developmental screening. And we're going to work on oral health and healthy weight starting in the spring. So part of the IHOC, is a CHIPRA grant is what we call it, Improving Health Outcomes for Children in the State, is really to align with the other things happening in the state. Payment initiatives, the ACO work, quality improvement infrastructures, and we're really trying to line up for the childhood groups, the metrics. So what we did with Improving Health Outcomes for Children is we started to look at all the different metrics across the country and nationally and came up with a list. It's called our IHOC Master Measures List, and we looked at childhood immunizations, and we've looked at weight, we've looked at asthma, lots of different metrics. These metrics are coming from the CHIPRA core set of metrics, the 24 federal measures that they want us to look at and Medicaid to report nationally. It's looking at meaningful use, the NCQA, Bridges to Excellence, the asthma metrics. It's looking at all sorts of different metrics out there. And we've come up with a list of 51 metrics, which we think we should start to follow for children. Unfortunately, as you know, it takes a long time to get metrics into action. It's good to come up with a list, but actually operationalizing it takes a while, and that's what we're working on. So I just wanted to highlight for you what's been happening for pediatric immunization rates. We were actually on the first phase of First Steps was on raising immunization rates. We were with 22 practices, both pediatric and family medicine, and 2 inpatient hospitalist groups in the first phase, and lots of partners. We've been working with the healthcare systems, the vaccine board, Maine Immunizations Coalition, the Primary Care Association, the main chapter of the AAP, the Academy of Family Medicine, working with lots of groups in addition to Maine Care, Office of Information Technology, and the Muskie School on this project. And you're part of it. Ted's been a big supporter. So this is just the map of practices that we've been working with. They're kind of spread out all over the state.
Let me pause there. So most of you had a colleague who's already endorsed this.
Yes, and we'll get to that slide in a minute. Working on the ground.
Lay the groundwork, yeah.
So when Ted said we're building a Maine Child Health Improvement Partnership, that is true. This is something new in the past 2 years. We're really trying to put a structure to the quality improvement work to improve child health in the state. Health care, and the mission is really to do measurement-based efforts to enhance child health care. So it's not just that we're going to do a quality improvement project, but we're going to measure how we're doing and make sure we're making some improvements. And so that's why we've been really focused on the metrics. What are the metrics going to be? And our vision is that all practices providing health care to children will have the skills, support, and opportunities for collaborative learning needed to deliver high-quality health care. Maine Quality Council is housing this. We're being funded through CHIPRA, but actually this is really a partnership. We cannot do it by ourselves. We're really relying on healthcare systems, the practices, Maine Care, the CDC, the family groups, everyone to come together and work on this. And we're not the only one doing work. There's a lot of other groups that are doing work on specific things, and we're really trying to partner with them, like Let's Go from the first two, some of the work that MCD is doing, some of the work up in Bangor. We're really trying to find who's doing the best work in the state and spread it to the other practices and healthcare systems. We're trying to break down some of those silos because no one can do this alone. No one's funded to do this alone. So we're really trying to build a partnership. So our goal is to improve preventive services for Maine children. For our first phase, our goal for this year, from September 2011 to September 2012, so we're just finishing the year, is to increase by 4 percentage points the immunization rates. And we're looking at 2-year-old, 6-year-old, 13-year immunization rates with the 24 practices. And amazingly, by 7 months in, we'd reached a 3 percentage point improvement, which is amazing when we're looking at population base. So we have really worked with the practices. They're really moving the bar for immunizations. Our evaluation's being done by the Muskie School. They did the initial evaluation at the end of the first phase, which was the first 8 months, and they're going to do an addendum at the 12-month mark. We saw a 57% increase. 57% of the practices increased their overall rates by 3%. We saw improvement from 0.4% to 16%, big jumps in improvement. 70% of the practices had improved rates in Impact 2, and the good thing is we're really focused on having them review their data, and now 82% of their practices are actually reviewing their data. We did monthly data reports out of Impact 2 on the back end for them, and they've been reviewing it all throughout the collaborative, and now we're going to quarterly reporting. I just wanted to show you, we are seeing big increases. The average change was about 3% improvement, but one of the practices was at 16%, and we just had a dinner and recognized the top 5 performers, so we had great performances by most of the practices. I would say on the bottom you'll see a few of the practices didn't change as much. Those tended to be our high performers that started out high. There was less place for them to go. But the groups that were at the bottom actually made big jumps. The other thing is we're really trying to emphasize Impact 2 being the gold standard for immunizations in the state. We had several practices come into Impact 2 during the project, and a lot of those did a lot of data entry and data management to get their patients in. I know some of the healthcare systems are doing their own work with immunizations, and they put it in their own registries, and they don't necessarily want to go into Impact 2 because of the double entry. Some groups are doing double and triple entry. We realize it's a huge issue, and it's one that people are working on, but it's not resolved yet. But the reason we feel like Impact 2 is the gold standard is because, one, it has what's called a forecasting tool and a scheduler. So it tells you that you've been given the right dose at the right time with the right interval. And it is a communication tool. So if a child goes from a practice to the next, their immunization records travel with them. Without that, we are not doing quality work. So that's why we're saying we need to get groups into Impact 2. 70% of the kids in the state are in Impact 2. The goal is to get them to 90% in the next 2 years. So we're really emphasizing it, but we do know that that is a burden on the practices at this point with the double entry. So believe me, we understand. The other thing is when we're looking at rates, and it's going to be reflected in the PTE that we're talking about, we are talking about measuring rates based on the federal CHIPRA measure. They look at rates at age 2 and age 13. So at their birthday, did they get all their shots up to date? What we found with the Learning Collaborative is that many groups had to do a lot of work on catch-up vaccines. Kids who had missed their shots at age 2 and age 13, and now they're catching them up, by the age of 3 and 14. And so that work of getting kids caught up is not captured in the metrics because they got their vaccines late. But Impact 2 is actually measuring that, and they've seen huge increases in the kids getting catch-up vaccines. So we know that's an issue with the data. Some groups are saying, our data looks really great when we go to our Impact 2 screen, but it doesn't look as good as what you have, and we know because their catch-up vaccines are not captured. And it will take about a year for that to work to catch up with them and to see those rates. The other thing is we know that there's some issues with rotavirus. Rotavirus vaccine, as you know, is given to prevent severe diarrhea. It's given in the first 8 months of life. You can't give it after 8 months. That's the recommendation from ACIP. Don't give it after 8 months. So the work that groups were doing to make sure the rotavirus vaccine was instituted in their practice we won't see that in their data for another 1 to 2 years because there's kind of a time limitedness to that. So what we saw for data was what they had done 2 years ago. So we realized that, and plus there was a recall 2 years ago in the spring. There was a little vaccine shortage, and we're just coming out of that time period. So we always get questions about that. The other thing that we're really trying to emphasize and put into PTE this year for your vote today is HPV. So HPV for girls has been recommended for several years. There's obviously some resistance for lots of different reasons. Plus, it's a 3-shot vaccine. And trying to get an adolescent in for 1 visit as a teenager is hard to get in for 3 visits before the age of 13 over 6 months is even more of a challenge. But it's really important. The studies out there are showing that it's a very good vaccine. It prevents cervical cancer, genital warts. You know, for boys, they're finding head and neck cancers, throat cancers. It's very important as a preventative. So actually, we're recommending it for boys now. So we're really trying to shift the continuum and say, let's stop focusing on the social issues and move towards, it is a vaccine that's going to prevent cancer. And let's get people to move in that direction. So there's been a lot of work on that. So the good news is, there's a lot of different data sources in this, but I just want to show you that in the state, the National Immunization Survey data was looking sort of crummy. And this is looking at 19 to 35 months old, so it's not exactly what we're measuring. But the state has really dropped down over the past several years. Steady stream up. 2 weeks ago, the new data coming out shows we have finally crossed the line, and we're 3 percentage points over the national average. So it's strong work. It shows there's been a lot of work done in the past year for lots of reasons. One of them, as you know, is the Universal Coverage Law was passed in January. Vaccines are free now, not necessarily free for the insurers, but they're free for all children under the age of 19. So we're really trying to build the momentum and get this work moving and say, everyone has access to them. Let's work on our practice strategies to get the vaccinations done. So we're developing a change package, all of the great models that we saw nationally, but also what we've learned here to spread the work of what practices are doing. So if your group did not participate in First Steps, there's a change package that's going to come out online to try to guide them in what changes they need to do. We also need to work on rewarding immunizations work. We've given out plaques for best practice, most improved, but we really need the healthcare systems and insurers to try to start to reward the best, the good work people are doing. We also want to recognize immunization rates with public reporting, so translate this to pathways to excellence, which is why we're here today, and design infrastructure to support practice quality improvement through HIT and impact. And that's part of the Improving Health Outcomes for Children with CHIPR grant. That's category B of our project. And then we want to get the message out to families. So I'll show you in just a minute. There is a new website that you guys could utilize for your patients. Here is the change package. So Sue Butstein, who you all know, and Cassandra Grantham, who's at Maine Health's Childhood Immunization Task Force, are putting together an online change package for immunizations for all practices in the state that they can access. It's pretty neat, very high tech. There's also the Vaccine Kids. In case you haven't seen it, there's a new website that the Maine Health Childhood Immunization Task Force has put together to get the word out and start to use social media for families. This is really around family education. So we're going to shift to the PTE measure.